Well, my philosophy for patient care is pretty simple. I mean, it's to provide quality care, but in a comfortable environment. I mean, all women are very anxious about going to the OBGYN for their annual exam, or even if it's more often for pregnancy. So I think it's very important to establish early on kind of a comfort between my patients and I, where they feel comfortable talking to me about any concerns they might have. And you know, I just try to tell them that I always treat every patient like I would treat a family member, and that's really what I strive for and hope that my patients feel comfortable around me. And I think that's really important in choosing a doctor in any field, because communication is pretty much the key to a good relationship between patients and doctors. Originally, I chose to be a doctor just because, I mean, I've always had an interest in the field, taking care of patients, disease processes, understanding what's going on. So that's what originally kind of got me into medicine. But then during my third-year rotations, as a lot of people do, you're exposed to kind of everything. And originally, I was gonna, not do a surgical field, and loved surgery. And then once I got into primary care, I really liked that too. So OBGYN gives you the continuity with patients. You do primary care, but you also do surgeries. It's kind of a good all-around field, so that's why I chose it. And of course, I love delivering babies, and that's a great process to experience and kind of enjoy with your patients as well. I like to focus on young women's health, college age and newly married and things like that. I have a real interest in that and love to take care of those patients. They're new to this, they've never been through this before. I like to talk them through that first visit and really kind of inform them about good choices in life in general, but specifically related to GYN care. Sexually transmitted diseases, HPV viruses, things like that. I go around to colleges and talk to those, so I feel very comfortable and very informed about those, and I want to make sure that my patients understand it, because a lot of times those things don't necessarily have symptoms when you immediately get them, and it's not until years afterwards that you have to kind of feel the effects and take care of those later. So I want to make sure that they understand and make an informed decision when that time comes. People are coming in typically for a reason, whether it's annual exams, but they have something else going on. So I think my mission is to just provide good care in a comfortable environment.